Welcome to Mom Breaks. Today we talk with Dr. Brooke Laufer. She's a clinical psychologist specializing in perinatal and reproductive mental health, including postpartum psychosis, infant loss, and perinatal trauma. In her private practice based out of Evanston, Illinois, she provides therapy, consultation, and expert guidance to clinicians, attorneys, and medical professionals. She's an author of a recent paper, It Shows You Your Fears, a qualitative analysis and psychoanalytic interpretation of the psychotic content of postpartum psychosis, which explores the inner experience of mothers navigating psychosis after childbirth. We also touched on one of her other papers, Domestic Violence as a Risk Factor of Maternal Filicide, in a previous episode. Dr. Laufer writes and speaks on postpartum mental illness, maternal filicide, intimate partner violence, and the complex psychological worlds of new and expecting mothers. She's also participated in advocacy efforts to include postpartum psychosis in the DSM. A quick note, in this episode we talk about Dr. Laufer's work as an expert witness in cases involving infanticide, and she references and talks about details of a case that involved the drowning of an infant. So take care while listening, and if you need to come back to this at a different time, please do that. Welcome, Dr. Laufer. So excited to have you.
Thank you. I'm so happy to be here. What a great adventure you have in this podcast.
It
Such
is.
wonderful people, yeah, that you've
Yes,
brought in.
I've been so honored to have so many people share their stories and now have quite a few experts coming on,
Right?
including you. You're our first psychologist. So thank you for coming on to answer some questions.
Perfect. I love it. I'll represent all psychologists
All of
here
psychology.
on there. Yeah, right, exactly. Funny.
You've created a career around perinatal mental health. Can you share what motivated that focus for you?
Sure, yes. When I had my first child, so about 16 years ago, I had this harrowing postpartum experience where I had these intrusive thoughts. It was really like an intrusive voice that had a different sound than my own voice, that had these commands and ideas and suggestions to bring harm to her in some way. And it was just shocking because I was a psychologist. I had never heard of something like that happening. I never heard of moms talking about it. Certainly, like my OBGYN hadn't warned me. Luckily, at the time, I had a psychiatrist who I called and he answered his phone, which was also just so unheard of. He answered his phone and I was like, Scott, I'm having, this crazy thing. He's like, that happens to people. That's the thing. You need to read Karen Klein and I'm gonna change your meds and this is gonna be okay. And it was amazingly calming. And I remember I told my husband at the time, and he's like, yeah, I don't think you're really going to do those things. It's like people knew I wasn't bad and I was just having intrusive voices. Um, so thankfully, I had support around me and I had medication and it passed pretty quickly. But after that, I was very interested in taking a deep dive in perinatal mental health. So I got more training, I took more classes, I got certifications and designed my whole private practice that has now become a group practice around perinatal mental health. I mean, mostly we see new moms, and moms who've had loss or moms who've had depression, anxiety after having a baby, some psychosis, but mostly the psychosis that I work with is with the other organizations that I'm in. Mhm.
Yay for accessible psychiatrists who answer their phone. That's
It's
amazing.
it's really, and the later we talked about it, he's like, I answer my phone on Tuesdays. It's the only day
Oh,
of the week. And I just happened to call him on a Tuesday. And
oh,
he has
wow.
since retired. He was just really a fabulous psychiatrist. Yeah.
That's amazing. You said reading Carol Klein. What is that?
Karen Klein.
Oh,
Karen
Karen Klein.
Klein. I have one of her books in here. I'm sure I have like two of her books. But she wrote like 20 years ago about perinatal mental health. She was one of the first real authors, psychologists on this topic. She is foundational in the work that I do. It's psychodynamic, but a ways of
Okay.
approaching. And one of her books is, I think, called Holding Mothers, and it's all about like care for the mom.
Oh, okay. So she's a psychologist
Yes, an
or okay,
author.
an
Yes.
author, writer. Okay. Can you share more about what you do professionally and when women come to you for care?
Yes. So I'm a psychologist. I have this private practice that has now become a group practice that I started about 16 years ago in Evanston, just outside of Chicago. I have a relationship with lots of OBGYNs and pediatricians and other clinicians and providers around here. So they know that I'm like
The
a referral
person,
for the new moms. And for years, I was getting so many of those referrals. I would say since the pandemic, we get a lot of adolescent referrals now too, because the mental health in teenagers started to dip. But yeah, we still see a lot of new moms, and mostly women will come in, that the really the 4 month, like after bringing home the baby, is sort of this classic sleep regression time.
I remember that.
Yeah, it's really nightmarish, very scary.
Yeah.
And often women's moods will dip during that time for various reasons. The hormones are fluctuating. If you're breastfeeding, they stay stable. If you're not, then they will dip,
Oh,
yeah, around that time.
really?
And and obviously sleep deprivation. So I would say we get a lot of referrals at that period. Um,
Mm,
and a lot
mm,
of it is just telling women this is normal. Like, you
mm.
aren't crazy. Being a mom is so hard. Please stop like checking your apps for baby weight and stop monitoring your child for like tummy time and, you know,
Like breathe a little.
just breathe a little, trust your instincts. It's okay to admit if you hate this. Um,
Yeah.
yeah, sort of expanding the range of what is permissible for their experience
Hmm.
and taking all the shame out of it can be really
Yeah.
helpful.
Yeah. So it sounds like you had your 16-year-old and then started a private practice shortly after. Is that right?
Exactly. Yeah.
Oh,
Yeah.
like
I was
in the
already,
midst of your experience. That's
yes,
amazing.
I started very slowly, like one client, two clients. Um, but yeah, it did all happen around the same time. I luckily had help, I had a nanny. So, and my office is connected to my home and has a separate entrance. I would work and then nurse and come back and work. And then I did that with my second one. And so I was able to integrate mothering and working.
Yeah.
Yeah,
Yeah. Really
luckily.
beautifully. Mm. That's amazing that you were like you had that empathy and able to start then to build this practice support moms as you
Hmm.
yourself were like navigating motherhood.
Right. And then
Mm.
even clients watching me like get pregnant or
Oh.
clients hearing my kids scream, like if the sound machine wasn't working that day or something. So very much connected to my own personal life was my work life.
Yeah. Yeah. So from a psychologist perspective, PMADS and specifically postpartum psychosis, I'd love to hear how you define postpartum psychosis today and how it's distinct from other PMADs.
Hmm. Well, postpartum psychosis is so much more rare than any other perinatal mental health experience. It tends to be very acute in that it's a psychiatric crisis and almost necessarily requires hospitalization. It can be fatal for mom and baby. So
Yeah.
that really is what sets it apart from any other perinatal mood disorder. But also, it's completely recoverable. It may take a year, it may take 2 years, but moms can really restore full mental health and capacity and have more children
Hmm.
without that experience in the years after having postpartum psychosis. So it is a really unique, very intense, potent, shocking experience. And it is psychosis, so that it's, the bizarre thoughts, delusions, hallucinations, often starts with mania, restlessness, like an agitation, this feeling where you don't need to sleep. And then will transition into I've become the savior for the world and I have to like rescue my
Everybody.
town from the flood. Yeah. Lots of religious content in postpartum psychosis. It's incredibly destructive. I think most psychosis, if you let it go unchecked, has a destructive end to it. But if treated, it can be really transitory and very much, like I said, recoverable.
Hmm.
I love this reminder that postpartum psychosis is so treatable and that recovery is possible when it is treated. Wanted to jump in with a quick note. Earlier, Dr. Laufer referenced the work of Karen Kleiman. She's an internationally recognized expert in perinatal mental health. She has a book called The Art of Holding Perinatal Women in Distress that gives a framework for creating a holding environment for women who are navigating postpartum journeys that are stressful. And this has shaped approaches for therapists who work with women postpartum. So she has it's called the Postpartum Stress Center. It's a hub for therapists, like you could find therapists through them, and training for therapists. So their therapists looks like they have a presence in Philadelphia, Pennsylvania, and then they have New Jersey and New York licensing too for telehealth, and all of it's virtual, all with a focus on perinatal mood and anxiety disorders. So, yeah, I'm glad to know that is a resource. And also, another note, we've talked in previous episodes about language, particularly the word rare, when talking about postpartum psychosis. While it does occur far less often than other perinatal mood and anxiety disorders, I tend to use the phrase less common, not to dispute the data, but because language shapes recognition. And when something is framed as rare, it can feel distant or increase the chances of it being overlooked or rather not looked for. And so we've heard some survivor stories where physicians aren't able to identify some of these symptoms and therefore care. And so, yeah, I've learned from, socializing in the advocacy space around postpartum psychosis that this is, there's a shift to use the phrase less common as opposed to rare to help destigmatize and improve recognition of postpartum psychosis in clinical settings. So it's a small thing that hopefully will help some get better treatment. Let's hear Dr. Laufer's reflections on what the arc of recovery can look like.
Well, yeah, I mean, there's several stages of recovering from postpartum psychosis, as you know, and it's unique to every person. Often because there can be this adrenaline rush with psychosis in general, like this
Mm,
larger than life feeling and pressure and power, that then there's a crash after postpartum psychosis
mm,
where your neurotransmitters are now in like a very depressive state. So sometimes after postpartum psychosis, we're treating severe depression. We're also treating PTSD because it's traumatic to have this experience of losing trust
yep.
in your mind. And so we're treating flashbacks and nightmares, but also really processing that your own mind and body were out of your control. And
Hmm.
that's a very unique experience that's unprecedented and often doesn't repeat itself. And the vast majority of people never experience that, right? So to
Hmm.
have this really uncanny, wild, unexplainable experience does take some processing and acceptance to move through it. And that,
Hmm.
I mean, that can take years beyond recovering from the symptoms.
Yeah. I feel like I, to this day, and this is also just safety, I always put knives after they're done being used into the sink. I had a moment where I cut myself before I was in active psychosis. And so it's just like a hyper awareness of sharp things and not wanting accidents to happen. But
Hmm.
every time I find my spouse has left a knife out, I think about my psychosis.
Hmm.
And so there's this like, what if something had happened? And
Mm.
like putting away a knife. Anyway, that's an example
Yes.
for me in my journey. I'm just sensitive around knives being left out.
Hmm. Hmm. That's a perfect example of a PTSD trigger that
Hmm.
brings you back to the experience. It doesn't sound like you're fully re-experiencing it, thank goodness,
No.
but you're considering it, right? Like the whole experience comes to you again. And I imagine if I checked in with you in like 10 years,
Yeah.
it would happen less, but that may be the symbol that always holds the experience for you.
Maybe. Yeah. And I wouldn't say I'm feeling traumatized by it. It's just a thing that I do now. It's just like I don't want any accidents to happen, which I think even moms who haven't experienced psychosis probably are like, let's make sure the toddler is not getting the sharp knife. Um, but
Mhm.
I often am like, I'm so glad nothing worse happened with
Yeah.
anything in my psychosis.
Yes.
So you already spoke to some challenges for clients as they wrestle with their experience. Any other large barriers or challenges that you see in clients after the acute psychosis has passed?
Mm, certainly finding providers who have been
Mm,
educated in perinatal mental health. I mean, we tend to be around large cities or universities. And so if you're in a rural area or a place where there aren't a lot of colleges, tends to be less information. And then there's always the fear of being judged and shamed,
hmm
that you're doing to yourself often. Like I didn't have this natural experience as a new mother. I had this crazy experience. It's hard to admit that if you know you're not in good company.
hmm
Um, I would say those are probably the two biggest barriers. I mean, then there's just health insurance in general in this country that creates a barrier.
Yeah.
But yeah, the
It's,
stigma and the lack of education in providers, I think makes it hard.
I feel like there's also because I'm in the New York City area and there are plenty of specialists that I feel like I'm only just learning about this year. After my experience, I met with psychiatrists who were not specialists in perinatal anything.
Hmm.
And I didn't know to advocate for that, I
Hmm.
guess. Like, I don't know. I guess it was just that's what they assigned to me, like in my discharge papers. So I think there's
Uh,
also like a almost PSI is amazing for this, like helping people find resources in their
hmm.
recovery journey. It seems like there's a there there.
Hmm. Hmm. Yeah. I mean, I think we also are in a time in the last 20 years, maybe 10 years, where there's been an increase in awareness around these issues.
Totally.
Yeah, it's just amazing. Um,
Yeah.
kind of started with like Brooke Shields, right? And that's even more like 30 years ago. But people just admitting that they didn't feel right after having a baby. And then cases like
Hmm.
Andrea Yates, sort of the
Yeah.
confluence of those media events and more women speaking out. And so now I would say there are, especially where I am, that where it's just saturated with therapists, there are so many perinatal specialists.
It's great.
And so probably like where you are too. But you wouldn't, if you weren't interested in that, you wouldn't notice it or think about it, right? It's,
Yeah. Yeah. And I think for me, it was like I was treated in a general inpatient psych ward. And so the psychiatrist there had no experience with
right.
postpartum anything. And then they like assigned me to people who were
Uh,
available and not necessarily people who knew postpartum psychosis. I don't know
yeah.
how we'd change that, but
Every hospital should have a perinatal psychiatrist who is on call for the ER.
yeah,
I mean, that would
that
just
would have been
be
nice.
right. To even do a consultation, and then they can educate the working psychiatrist or the docs who the inpatient folks are seeing. It doesn't seem like a tough
Thing. Yeah.
requirement, yeah. But it has to be, Honored. It has to be considered a real event, which requires a diagnosis, which requires postpartum psychosis being entered into the DSM.
Right. Yes. Can you share more about why you feel it's important for it to be in the DSM?
Yeah, I mean, I feel like it's important for this reason, what we're talking about for care at hospitals and inpatient units, because if something is an actual diagnosis, a system will create providers to treat that, right? Then you create a treatment
Mm,
protocol and then you can create education around it and there can be funding around it. It can be taught in med schools and psych schools. And
hmm
it just gets so much more attention and like heavy lifting, instead of just like, oh, this extra thing that I heard about, I kind of read about, I had to do an extra webinar on it like for a psychiatrist, right? They're not getting any formal training in it. And so then those are our specialists. But if it's an actual DSM diagnosis, it gets more money and more attention.
Yeah.
Hmm.
So you have helped with legal cases around infanticide. How have you seen a lack of classification play into how those unfold?
Yeah, that's a really tough obstacle without postpartum psychosis as a formal diagnosis. When I'm writing reports for women who have had postpartum psychosis and who've ended the life of their baby or ended the life of someone else
Mm,
during postpartum psychosis, I have to find this psychological linguistic gymnastics to describe
mm,
it that fits within the DSM, but is still describing postpartum psychosis. So usually I will use diagnosis like bipolar disorder with psychotic features or brief psychotic disorder or dissociative disorder with psychotic features
hmm
to explain the same thing. But certainly if postpartum psychosis were a recognized diagnosis, it would get more formal respect in the legal world.
When you're working with the legal world and choosing a diagnosis, I mean, of course, you're diagnosing whichever one's most appropriate, but do you find these are respected differently?
Yeah, basically, are you asking that if it was postpartum psychosis versus bipolar disorder with psychotic features, would it have more bearing on her case?
Yeah, like, or if people are like, well, brief psychotic disorder, what even is that? Or like that doesn't hold as much weight, or are you seeing that these different diagnoses that you can work under today still um are respected?
Yeah, yeah. I mean, that really depends on judge and jury and like how it
Sure.
all gets explained
Yeah.
um and often I will just say like this is postpartum psychosis, but I'm describing it
Uh,
as bipolar disorder with psychotic features.
uh-huh.
I think that it's all generally, those words are all generally accepted. I do
Okay.
think it would have more weight as postpartum psychosis.
Okay.
Hmm.
Okay. Can you share any thoughts on the efforts, momentum, or barriers on getting postpartum psychosis in the DSM?
Yeah, I think it's been about 7 years that they've been working on it. I only
Yeah.
joined that team 2 years ago, so I certainly haven't been one of the big spearheads. And I mean, there's a lot of history of women's mental health that is not taken seriously. Things like perimenopause or premenstrual dysphoria, right? Like severe PMS.
Uh-huh.
Like these are just starting to get accepted in the terminology and the diagnostics. So to have a woman's issue, a specific woman's issue, and then a mother's issue in the DSM is a tough battle because we want to believe that these conditions, becoming a mother is natural and it might be a little bumpy and she might have the baby blues, but like it certainly doesn't require a diagnosis.
Mm,
So I think
yeah.
that's some of the cultural pushback to it.
Yeah. It's surprising to me that there isn't some place for postpartum things. I mean, there's the specifier, right? Like with peripartum onset, but that is surprising to me that that doesn't exist already.
Hmm. Yeah, it's a really taboo sort of area. I mean, motherhood is like this pinnacle of femininity. Like everything depends on us believing it's going to be okay, and
Yeah.
it's a woman's purpose, you know? So to put pathology on it, I think is destabilizing in a way for this
Hmm.
puritanical culture where we're still in this Madonna whore complex, right? Like a mother is all good or she's like a deviant.
Uh-huh. Yeah, I see this culturally. There's like this, we need women to be mothers, but
Yes.
like a lack of putting resources or like actual value or like intention behind supporting mothers in policies, in systems. And so I think it's on the woman to be okay.
Hmm.
That's my take anyway. Uh, so from a clinician standpoint, for new moms who have experienced, I guess, PMADs generally and are still struggling, what do you say to them?
Well, like I was saying earlier, I mean, I say like this is normal. All of your dark, negative feelings you have about being a mother or about your baby are totally acceptable.
Hmm.
And reminding moms that their whole sense of self is not dependent on being a mother, that there are still these other pieces of themselves that I really want moms to nurture, um, especially creative endeavors, any sort of like singing, dancing, art, where there's something life-giving for a mom that's outside of raising her kids. Um,
Hmm.
yeah, finding ways where moms can balance work and being a mother, I also really support. I don't think there's a right way to do mothering. I don't think that breast is best or something like this. I think you have to look at the whole picture of the family system
Hmm.
and make your decisions according to what keeps the harmony for the greater good.
Hmm.
But central to that is mom's health.
Yeah. So thinking of a family system, what would you say to partners and families who have just gone through postpartum psychosis with their loved one?
Mm. What would I say to the families
Yeah.
of
Like
it?
as they
Yeah,
recover.
right. Yeah, and I used to run those groups for PSI.
Oh,
Yeah,
really?
for family members, and now I do the groups for survivors. But the family member groups were so wonderful. I mean, often people have experienced trauma,
Hmm.
actual trauma because they were witness to maybe a near fatal event.
Mm.
Oftentimes, there's a restructuring of a family system too, like a divorce or a breakup or a argument. I mean, it's a lot of like picking up the pieces and putting them back where they now best serve the family system.
Hmm.
I think that family members need to have their own support so they can still support the survivor. If you're in a heterosexual couple and mom becomes pregnant, now it's dad's job to take care of mom, and it's mom's job to take care of the growing baby and then the baby. And so it would be nice if there were some in-laws or people around to take care of dad, you know, like we
I
have to,
love that.
yeah, building out the support. Because I don't want, I'm very protective of mom, like resentment or accountability or
Mm.
explanations. She doesn't deserve that sort of conversation.
From a partner.
Yeah.
Oh, about the experience or
Right.
yeah, yeah. Yeah, get a therapist, talk through
Exactly.
it.
That's what I'm saying. That's what I'm saying.
Yeah. Uh, I have been so looking forward to hearing more about this paper. You have a paper that came out this year. It shows you your fears, qualitative analysis. Can you share the premise of what drove you to do this work?
Sure. Yeah, I am plagued with thinking about things psychoanalytically persistently. So I'm always thinking about the why behind, or the symbolic or what meaning is there. There has to be some meaning. There has to be some purpose for an event to happen. So when I've been working with moms who've been through postpartum psychosis, especially in the groups, and hearing them describe their experience, I want to salvage some of even the craziness of it and find meaning in it for her post-traumatic growth, really, like to give it back to her, like this wasn't for nothing. Okay. So from that feeling, I created this study where I had 14 women and I interviewed them. And in a semi-structured way, I asked the same basic questions just about their experience of postpartum psychosis to see if there were any themes. I mean, I already knew there were probably going to be these overlapping stories because I'd heard a bunch already. Um, but if I could pull out some of the content and apply a psychoanalytic interpretation, like why does this storyline come up in postpartum psychosis over and over again? Like, what meaning could this possibly have for a mother? So that's what I did. And I found some overlapping themes and used some past, psychoanalytic theorists and applied ideas. And
Hmm.
yeah,
What were some of the themes that you saw recur?
well, certainly the religious content
Mm,
that the mother is in this battle of good and evil that centers around the baby. Um,
mm,
that the baby is there sort of like a messiah or a sacrificial lamb or some religious symbol. It's like a spiritual warfare. And
mm,
sometimes it's just like in her home, sometimes it's in the greater world, sometimes she's a proselytizer or a savior. That was one of the themes.
mm, hmm. I remember seeing a phrase like crisis of maternal identity. Was
Hmm.
that one of these recurring themes that you saw?
Well, that was, yeah, a way of interpreting the themes. So
Okay.
like there's a persecutory theme, that I'm being chased, people are out to get me, a paranoia that you're wanted as, you're wanted for a
Hmm.
deadly reason. I think the maternal identity crisis, like it is such a huge transformation to become a mother. And there's really not a lot that can prepare a woman for that. It can really shock the system, and there can be surprising feelings and thoughts about it. And if those have no space to be metabolized or integrated, sometimes I believe they will be projected in psychotic themes.
Mm,
So a sense of like feeling like harm should come to the baby could just
mm,
be another way of acting out like I'm so scared of being a mother. I'm in a crisis of identity, not knowing how to care for this child. There's a
mm,
part of me that wants to eradicate that feeling that the child represents. Or this sense of being persecuted, like now this baby is here. Forever, I'm going to be like judged and run down by the expectations of motherhood. Another surprising theme that came up was this preoccupation with bodily fluids,
mm.
which I, again, attribute to this transformation into motherhood. I mean, it's such a bodily experience, right? Like all of a
Yes, it is.
sudden. Your like organs are in different places and your body will
Uh-huh.
never be the same.
And lots of new bodily fluids that you'd never knew
Exactly.
were a
Exactly.
thing before.
Right. And that feel uncontrollable sometimes.
Mhm.
So sometimes women like wanting to check their blood pressure all the time or convinced that they didn't have bones anymore or that they had missing organs just seem to speak to this psychotic and exaggerated fear of what had just happened to their bodies. That again, they weren't really able to metabolize. Maybe there wasn't context for that or a container where someone was helping them, through that change. And so if those feelings don't have a way of being mitigated, I do believe they'll become psychotic.
Yeah, that's come up in, there have been a few survivors who've come on the show and talked about really crazy birth experiences, like birth experiences that were deeply traumatic, and there was no acknowledgement or support
Hmm.
afterwards
Hmm.
in like, hey, you felt the emergency C-section. Let's get someone for you to talk about that with.
Hmm.
Let's give you some space, some extra support to help you understand
Hmm.
that. But like instead, it's like kind of the focus is on the baby
Hmm. Right,
and
exactly.
whatever the baby's needing. And so then mom is also focused on the baby and not processing her own stuff, which
Hmm.
it feels like there is a place for, I mean, again, a perinatal psychiatrist to be
Right,
like
right.
in a
On
labor
call.
ward.
Yes, exactly. I think that moment that you just described is so important because once baby is here, everything in the culture, starting with those providers at the hospital and often the partners and grandparents, are messaging to mom that now we're focusing on baby. We're
Hmm.
not focusing on you anymore. This is the
Hmm.
most important thing, and you're naturally going to be a mother and dealing with baby, and we all will enable that when really she's just been through the most insane thing of her life. It needs to
Hmm.
process it. Hmm.
Yeah. Yeah. How do you see a meaning-centered view influencing treatment approaches?
Yeah, I think that treatment of being hospitalized or using antipsychotics or mood stabilizers is essential. Like that's first line
Of
treatment.
course. Yeah.
I just feel like I have to state that because the psychoanalytic approach, even historically with psychosis, is not always welcomed because it doesn't secure stability as much as like antipsychotics do.
Yeah.
But per the idea of meaning making, I mean, I think in treatment, in psychotherapy, after the fact, when a woman is starting to process what happened, I think bringing in some of those themes, like really noting her story, not dismissing it like it was just crazy talk, but really having reverence for what came from her unconscious could be profound for healing.
Yeah. I feel as I reflect back, it feels like I had this exponential reflection work in like 2 days that came out through my psychosis that then has taken really years to like sit in, think through, process. But I feel
Hmm.
like it like launched me into so much self work
Hmm.
that I'm so grateful for. I would never wish it on someone, but it also was hugely transformative.
Mm, I'm so happy to hear that. I mean, you must have had a non-defensive response to your own experience, which is really beautiful. And a
Uh-huh.
naturally curious mind, which I think is great. And I think that, yeah, it can take years, but it's like dreams.
Mm.
Dreams are meaningful. They are our unconscious trying to work out things, just like psychosis is. But what I just said requires like a paradigm of belief. I believe that. I've been trained that way and I just believe it.
Hmm.
But not everyone does. Not everyone
Yeah.
does. So I really applaud you for trying to integrate. And that's why I chose that quote as the title, because it shows you your fears. That's what someone in the study said to me when we were talking. Like her psychosis showed her everything about her psyche, like a raw,
Uh,
exposed version of herself that gave her so much information to think about. Another woman said, since her postpartum psychosis, she's like, I'll just say her name is Lisa, like Lisa 2.0, like the
hmm.
next better version of herself. Some people are trying to find growth in that experience, which I think is just beautiful.
Yeah. I mean, I think there certainly was judgment for me. Like, I mean, there's no way I can't judge that I just was a psych ward patient. But I think
Yeah.
maybe, like you were saying earlier, I think there are stages of recovery, like acceptance, and then once accepting, like, okay, this happened, like, what does it mean? I don't know. I don't know what this,
Yeah.
what would you say the stages were if you did have to label them?
Yeah. I mean, I would say stabilization, safety, which could take a while, especially if someone goes into that awful depression afterwards.
Yeah.
So just stable functioning. And then processing, like getting back into allowing yourself to be in your feelings and trust your mind again. So
Hard.
like reclaiming, yeah, trust and self. And then I would say meaning making, just like you said, and then like the growth idea in that third stage. Yeah.
Did you have religious delusions are common, right? Did you, in your interviews, hear reflections of women in their spirituality?
That's such a good question. Yes. And some women who had religious delusions weren't
Weren't
practicing it
even
right,
religious.
which is really interesting, but some were for sure. And one in particular said that after she had to be very careful about her religious practice because it acted like a trigger.
Oh,
Yeah.
a
Um,
trigger for,
for post-traumatic stress.
okay.
hmm Um, another woman, yeah, I'm actually just thinking of a case that I just got that I'll interview a woman, so a forensic case, which is different. But her postpartum psychosis was so religious. Um, a lot of the heavy religious stuff is based in something that's real, right? Like
Hmm.
this woman this case that I'm on now, she is Catholic, but the baby's daddy is Protestant, and she's from Mexico,
Hmm.
but she is in the States, and she wanted to baptize her baby at a Mexican Catholic church.
Hmm.
But since he was Protestant, he wouldn't let her. And she became psychotic. I mean,
Hmm.
she became psychotic not just because of that, but because of a series of underlying
Right.
issues and blah, blah, blah.
Multifactorial. Yeah.
Yeah, exactly. But her psychosis was fixated on a baptism.
Oh.
Yeah. And then she did it herself. And that, yeah, did
Oh.
not go well.
Oh.
Right.
Yeah.
Right. But I mean, it was filled with religious icons, stories, beliefs, stories from the Bible, I mean that it's definitely, and I need to know more, but one of the most religious postpartum psychotic stories I've heard.
Yeah. Yeah.
But
Oh.
it can really be that way. So I think if there is religion in your life, it can amp up that religious content.
Yeah, that's what I've read too.
hmm
Like you are more likely. I think there's one paper I mentioned in a previous episode that if you are religious, you are more likely to have the positive symptoms of
Mm.
so like the things that other people don't see or experience.
Yeah.
You're like, and so as someone I was raised religious, and there
Mm.
are so like thinking you have a special mission, like grandiose thinking. These are things that like were kind of part of my religious practice to a degree, like finding meaning in the mundane.
Yes.
So for me personally, it tracks, like being more
Yeah.
likely to experience those things.
Yeah.
But I've also been, as I've talked to survivors, and because of my own like journey and how my psychosis has influenced my spiritual path,
Hmm.
I've asked people, and some people that I've talked to, it's like it doesn't really influence
Hmm. Hmm.
spiritual inclination
Hmm.
or practice, and other people, it's like a transformative thing
Right. Transformative. You mean the postpartum psychosis brought them like into greater contact with their faith?
or greater spiritual, yeah, feeling
Yeah,
like more desire to be
exactly.
spiritual or like feeling more connected to
Yes.
you know things beyond them or to
Yeah.
people or to whatever it is.
Yeah.
So,
Hmm.
um, for someone who has experienced postpartum psychosis and feels shame about the content of their psychosis, what would you want them to know?
Well, that's another wonderful thing about analyzing it for meaning, because if I'm looking at content, I'm looking at it symbolically, not literally, not like, well, you literally wanted to end the life of your baby, but like
Mm,
symbolically, you felt overwhelmed by the feelings of becoming a mother. You were having a maternal identity crisis.
mm,
And so this is the way it popped up for you. It's the only way your psyche could figure out to get the message across.
hmm.
And I think that turning something into symbolism versus literalism can help with the shame. Like, oh, it really wasn't my personal intent. Like, I'm not this criminal actor, you know?
Yeah. How does that, in practice, what does that look like? So this idea of symbolic expressions of psychic distress,
Hmm.
how do you do that in practice?
Hmm. Yeah. Talking about what's going on in their lives, talking about um, making it safe for them to share their story, asking them if it's okay if I interpret it for them, finding ways that is normal in society, but we don't have a place to say it, that being a mom is hard or someday. And I will sometimes say, because I will make a lot of jokes and I bring myself into therapy a lot. So I'll say crazy things like some days I just want to kill my kids. Like, and that's totally normal. And it's normal for me and you, and just give them this like wider range of permission to experience and say something out loud can really help discharge the feeling and the shame. So yeah, working, specific to how that person is, where they're at with it. Sometimes asking people to bring in dreams
Hmm.
and looking at symbols in dreams and then connecting them to the psychosis. I mean, my analyst always is asking me to paint my dreams or feelings or thoughts or experiences.
Hmm.
So I will suggest that writing, I think, is good. I tell people just you can send me anything you want in between session. We
Hmm.
can talk about it in the next session. Yeah,
Yeah.
send me your dream, send me your poem, send me a painting, take a picture of it.
Yeah.
Mhm.
That sounds like quite like spiritual to
Yeah.
me. Well, and journaling is so powerful. I remember doing birth painting with my midwifery was like actually I think it was my doula who connected me to a book and it was quite healing and
Mm,
empowering to do art about my fears around birth before.
exactly.
Yeah.
Exactly.
So on this topic of shame and the work that you've done within the legal system, what do you wish prosecutors or judges or forensic evaluators understood about postpartum psychosis?
Yeah. I really wish that it was immediately understood as a psychiatric crisis,
Hmm.
that it is something outside of a woman's self and intentions, that it's a break with reality because too many prosecutors still talk about this as, infanticide as evil
Hmm.
or even postpartum psychosis because there's no other way to explain the disconnect from motherhood, that there would be a madness in motherhood. And this reference to evil, monster, locked up forever, if there's a deceased baby, someone has to pay. Like the mom has to go down, and it's just a really ugly part of our legal system. And if there was just a pause of understanding that we're dealing with a psychiatric disorder, the way we would with like schizophrenia, a diminishment of capacity, right, from knowing right from wrong, that could really save a lot of moms from life imprisonment.
Yeah. Is it like in practice, at what point are you brought in, or at what point do they have perinatal psychiatrists or people bringing in resources for the case before a judge is already kind of in the details?
Well, if it's a new case, lawyers will hire me right off the bat,
Okay.
before it gets to the trial, right?
Okay.
So I evaluate someone, I write up a report, I consult with the attorneys, I explain to them whatever I find, and then they use that report to build their case.
Okay.
And then oftentimes at the trial, they will bring me in and I'll testify to my report and
Yeah.
explain to the courtroom what postpartum psychosis is, etc.
Okay. So, I mean, that's kind of ideal. Like, I mean,
But yeah,
ideally, women aren't facing the
that's
legal.
right.
Ideally, this doesn't happen. But if there is legal involvement, they have a perinatal expert of some kind early
Hmm.
to build out the case. So, and do you feel that your work is helping women not have charges or have, or like, what's the impact?
Yeah, it's mostly an impact of lowering a sentence. It's rare for something to just be dismissed, you know, but and I do lots of different, I do a lot of post-conviction too. So
Oh,
that's reducing a sentence
like
after they've had
appeals.
their, yeah.
Okay.
Um, and that has been successful. So per your point, it does often happen where a lawyer will try to defend a woman without the perinatal evidence because it doesn't occur to them. It's not known enough.
Huh.
But now it's getting more airtime. So now post-conviction lawyers will come and find people like me to try to reduce sentencing or for like a clemency case to get someone just released. Um,
Hmm.
but if it's a new case, yeah, I mean, I think it's like a mitigating evidence that helps reduce a charge and reduce
Mm-hmm.
years.
Oh, well, I'm so glad you are doing the work you're doing to to help women who are in these situations because
Yeah.
and it sounds like you have a network of people who know what you do.
Hmm.
And yeah, I'm thank you.
Yeah. Oh gosh. I mean, I wish there were more. I mean, like you said, it's just this country. If this was in Europe,
Oh,
especially in the UK, there's this infanticide law. So it's
oh,
immediately treated like a psychiatric condition.
oh. Meaning, and like, what does that look like in practice for the woman? Like, she wouldn't have
Maybe
any court involvement.
no, like maybe a hospitalization.
Why don't we
Um,
have that?
I know it's crazy.
Like, like, yeah, give them like let's focus on that first stage of stabilizing,
Hmm.
and then I don't know, repercussions later. If And that's more, I'm saying repercussions more in like her own reckoning
Exactly.
with whatever. I feel like the
Right.
natural consequence of infanticide is enough.
Hmm.
Um,
Hmm.
so from your perspective, how can we improve the system here in the US?
Yeah, I mean, the infanticidal law would be ideal if we just adopted the law that the UK uses that's been around since the 1800s.
What? Why are we so behind?
The other big piece would be paid maternity leave, so
Yeah.
that it's just a less stressful time. There's just
Yeah.
more support or, taking care of and holding women. That's really what we need. Um, and then the other
Yes.
big thing would be postpartum psychosis in the DSM.
Yeah. That would be a
I would just like take care of it all.
trifecta. Like, win, win, win. Yes, I will that into the universe.
Same.
Is there work to get an infanticidal law in the US?
No, not that
Really?
I mean,
Oh.
that's God. How would that? We would have to do that at a higher level. I don't know. We should look into that.
I mean, at least, I mean, it's different government, like different systems, of course, but
I know.
that
I'm
seems
thinking,
like let's take a chapter out of their book and
like, would that be state to state?
oh.
We talked to Pritzker about that here in Illinois. Yeah. I mean, I wonder if
Yeah, it would probably have to start.
that's
Well, and
really
that's what's how
interesting.
like, the Massachusetts recently,
Hmm.
yeah, I feel like
Which
it,
we have in Illinois. I mean, that worked here,
oh,
only
great.
here. Yeah.
All right, a little more context here. First, Dr. Laufer mentioned Pritzker. This is the governor of Illinois currently. And I referenced a Massachusetts law. I meant a bill that has been proposed to create a law that would put treatment before punishment for women who are charged with crime in Massachusetts. So it would amend current law around mental health and competency. It would add a provision that defendants who gave birth in the 12 months prior to the crime would need to be examined by an expert in reproductive psychiatry to understand any type of complications such as from postpartum mood and anxiety disorders, including postpartum psychosis. So though for those who are determined unable, it would incompetent or impeded by some type of disorder, it provides requirements around inpatient treatment and you know process around outpatient and other treatment support and safety amidst the process of you know seeing out any type of trial. So it also adds that these any type of diagnosed condition such as postpartum psychosis or postpartum depression would be considered mitigating factors in sentencing for those cases, and that any past cases in which these illnesses were a factor and weren't considered, this law would enable resentencing. So that is what the current work, and there's a lot of advocacy around the Massachusetts bill that's currently being considered. And Illinois apparently already has this similar law as of 2018. It's a similar law that recognizes postpartum illness as a factor in criminal cases. So these perinatal mood and anxiety disorders would be mitigating factors in sentencing and also allows for resentencing for past cases. And apparently was one of the first states in the nation to create a criminal law to recognize postpartum illness. All right, as we wrap, I asked Dr. Laufer about other resources she would share. And here's what she had to say.
Yeah, so I wrote a book about this called Uncovering Maternal Infanticide from a analytic perspective, and it's Routledge. And so it just covers a
Okay.
lot of these topics. Yeah, that came out last year.
Amazing. Congrats
Um,
on the book.
yeah, thank you. I mean, Routledge, it's an academic press and it's like in the analytic niche. And they actually approached me because I had done some book reviews for them. And so I think this, again, to the point that it's a topic that people are more interested in. So I do a lot of different talks about motherhood, negative, dark mother experiences. I'm doing
Mm.
a course on, it's called the transmission of trauma through the mother line.
Oh.
Yeah. And then I just finished this group about healing from your own like mother wounds.
Mm.
And so now I'm going to do a writing workshop, like same themes, but with writing prompts. And
I think I need that.
that would be great. I would love to have you. I'll send you
That
the
sounds helpful.
information. Yeah.
Please do.
Just like a weekly virtual, and we just workshop and talk about each other's writings.
That sounds really helpful. That's amazing. Any final advice you would give to families who are processing an experience with postpartum
Mm.
psychosis?
Mm. I would say be patient, be forgiving and accepting of yourselves, but
Mm.
also look for the meaning in it.
Mm.
Like, what is this cracking open? What does this mean to you?
Mm.
Why could this happen as a way to serve you?
Yeah, growth mindset
Growth mindset.
within it. Yes, I'm all about it.
Me too.
I love this reminder to approach healing with a learning lens. So grateful to Dr. Laufer for sharing her expertise and for engaging with my questions. I loved the stages we talked through. First, stabilization, often through hospitalization, to resolve the acute crisis, and then the work of getting back to yourself, processing what happened once things are steadier, and then finally, a stage of growth or learning, making meaning of the experience without minimizing how serious it was. We touched on something nuanced and important. I mentioned positive symptoms can be more likely when someone is religious. I've linked that study and I've read a little bit of it again, and I wanted to highlight something that is interesting and important in this what we're talking about. Holding primarily religious or spiritual explanatory models was associated with increased symptom severity and delayed recovery in this study, that this systematic review about meaning and religiosity in the recovery from psychosis. So a biopsychosocial framework supported recovery. So in layman terms, understanding when a delusion was a delusion, a medical symptom, and not necessarily something meaningful is important to recover and not have recurrence of. Yeah, I guess that's one interpretation I have from that. So I thought that was relevant and important to, among those stages, remember it's important to recognize these things as medical symptoms as you are getting through that stabilization stage and processing. So, on a personal note, something that Brooke said reinforced something that I feel like I have taken away from in my journey. Have a psychiatrist. Truly, so many people do. There's a power in having a care team across specialties that you can reach out to, someone you can message if something feels off or if you have a question in their specialty. If you don't already have support or a connection to a psychiatrist, no matter your background, establishing care can make an enormous difference in the day-to-day life, but also if a crisis does come up. So that is something even people who have not had a psychotic experience can lean on. Also loved this trifecta of wishes for the future. I would love to move toward more informed and compassionate infanticide law in the United States, paid maternity leave, and the formal recognition of postpartum psychosis in the DSM. So those are three that Dr. Laufer touched on. I am right there. I am here to help advocate for those things. I'm fully behind them. And each of them can shape outcomes, not just clinically, but legally, socially, and culturally. So yeah, putting that out there. Would love to influence those things in some way, even if it's a drop in the bucket. Check out the show notes for Dr. Laufer's website, her course, her book. I will also link the original paper. It shows you your fears, a qualitative analysis, and the citations that we discuss. So lots of resources in the show notes. With that, be kind to your mind. Thanks for listening.